Good afternoon, everyone, and welcome to today's webinar, Updates on CDC's Viral Hepatitis Campaigns. My name is Ryan Clary, and I'm the Executive Director of the National Viral Hepatitis Roundtable. We are a coalition of more than 375 nonprofit organizations, along with government and industry partners, working to end the Hepatitis B and Hepatitis C epidemics in the United States. I'd like to encourage everyone attending to join in going to www.nvhr.org/join to sign up your organization, to join our coalition, and or mailing list as an individual. Before we begin today, I'd like to go over some logistics. The webinar is being recorded. Slides from the presentations and the webinar recording will be made available to everyone who registered and will be on NVHR's website, www.nvhr.org. All lines have been muted to eliminate background noise. You may submit questions at any time during the webinar using the chat function or by emailing Tina Broder, our Senior Policy Manager, tbroder, TBODER, @nvhr.org. I also want to thank Tina for organizing the webinar. We will have a question and answer period following the presentation. Today is particularly timely given alarming new surveillance data released today by the Centers for Disease Control and Prevention showing the problem of chronic hepatitis B, particularly among Asian and Pacific Islander Americans, the increase in hepatitis C infections, the burden of hepatitis C on baby boomers, and the sobering report that deaths from hepatitis C are higher than 60 other infectious diseases combined. Hepatitis B and C campaign materials to reduce morbidity and mortality. I am now very pleased to introduce Dr. Cynthia Jorgensen, the lead for Education, Training, and Communication in CDC's Division of Viral Hepatitis, where she and her team are responsible for the development and implementation of the Know More Hepatitis and Know Hepatitis B national education campaigns. Dr. Jorgensen has been with CDC for over 27 years. Prior to joining DV, Dr. Jorgensen led several national cancer prevention campaigns, as well as communication work in HIV/AIDS prevention. Dr. Jorgensen will provide an overview of the two campaigns, ways you can use the materials in your community. There will also be an opportunity to express your education needs for future consideration for CDC developed materials. Again, questions and answers will be at the end. We request all questions be submitted through the chat function or by tbroder@m. Now I want to welcome Dr. Jorgensen and thank you for joining us today.
Thank you, Ryan, and welcome. As Ryan mentioned, I'll be talking about updates on CDC's national hepatitis campaigns, and I'm joined by two other of my colleagues, Amanda Carnes and Sherry Chen. We'll be all together both sharing with you our campaigns as well as hearing from you about what some of your needs are. If I can go to the next. So the national education campaigns have actually been referenced in the HHS strategic plan, both the first one and the second one, under goal 1.2, which is to decrease health disparities by educating communities about the benefits of viral hepatitis prevention, care, and treatment. So on the next slide, you'll see that we'll be talking about the two campaigns that Ryan mentioned, the No Hepatitis B campaign for hepatitis B, and the Know More Hepatitis campaign, which is focused on hepatitis C. I'm going to begin with the No Hepatitis B campaign. We launched this campaign of 20. Our goal was testing for chronic hepatitis B. We've engaged in a partnership with Hep B United, which many of you know is a coalition of coalitions around the country. They are key partners in helping us reach Asian Americans, and we actually are doing this campaign in language. Our languages are Chinese in the form of Mandarin and Cantonese, Korean and Vietnamese, and we have the materials also available in English, but this campaign is in language. We've released two subsequent phases of the Know Hepatitis B campaign. Phase 2 in August of 2014, and Phase 3 just recently in March of 2016 this year. On this slide is the campaign website, so you're welcome to go and visit and learn more about the particular campaign. So the next slide, talk a little bit more about some of the specific aspects of the campaign. Our primary objective is to increase testing for hepatitis B, but we also have some secondary objectives that are based upon our research with. We found that there was quite a bit of misinformation out there, both in terms of the burden. So we have messages about 1 in 12 Asian Americans are infected. As many as 2 out of 3 people are not aware that they are infected. The disease often has no symptoms, and a blood test is needed to determine if they're infected. We also found that people were not aware of the link between hepatitis B and liver cancer, so that's another major secondary message. And then we really wanted to try to decrease hepatitis B. A suite of campaigns on broadcast, we have PSAs and radio PSAs. Many of the materials also serve in the digital and social sphere. We have banner ads, infographics, buttons, and badges. They are very similar to what you see in a print format. We also have templates that are used for use in the community level. We have risk assessments. We actually got requests from community members about having a risk assessment that was not a digital online. We have fact sheets, print ads, and then we also have provider clinical tools. And all of these are available on that website that you saw on the previous slide. So the way we implement the campaign is CDC takes responsibility for implementing the campaign on a national basis. What we do is we identify in-language media outlets across the U.S., and then we partner with our community members primarily through Hep B United. This extends the reach of the campaign into the local communities, but more importantly, it really provides that direct education and services and testing, and most importantly, follow-up to testing for positive results. We use community leaders that are in the community, trusted by the community, and it's a great way for us to extend our messages to the people who need them most. So if you look on this slide, what we have is sort of our print, TV, radio, news, digital, and social media. We put ads in relevant in terms of print and radio and TV. You'll see that they're in the 3 languages, and then obviously with Chinese, the spoken Chinese, it's Mandarin and Cantonese. We also have our community with press events in their local cities. We have canned articles that we send in language. We've worked with our community members to have them get interviews with key speakers and Hep B United members. It's a way to extend our message through the news media. We also employ many of the same tactics that we do in English and on the C campaign. We actually have banner ads in the different, and we're also trying to be active on social media, probably a little bit more in English, but we do some of the social media in language. I mentioned Hep B United sort of extends the reach of the campaign. They are able to conduct that outreach activity in the Asian. They tie it into community health fairs and testing events. And one of the key components of those testing events is that they have strong linkage to care, so they don't test anyone that they can't follow up with and provide referral to them. And they also, our Hep B United partners, work about educating healthcare providers who are serving this particular community. So this is sort of our model for our campaign. So we have 2 new video TV PSAs. These are available in the languages you see, English, but also Mandarin, Cantonese, Vietnamese, and Korean. One is an animated PSA that talks about addresses some of the myths with hepatitis B. It does the myth of it doesn't have symptoms. It makes an analogy of there's no warning signs. And then the other PSA, you see a dialogue between a father and a daughter about why it's important to get tested. We also have a new ad poster that's both digital and print. These are available to order free of charge at CDC's warehouse. We have them in English and, again, the 3 other Asian languages. And I just wanted to remind people on the phone we have a suite of materials on our website. Again, because of a community request, we had a request for multilingual poster that would have English and all the languages on one poster. So that's what you see on the left. Just the one in the middle is one that's available in multiple languages, and then the infographic, also sort of a poster on the right, is just a sample of some of the other materials that are available on our website. We also have a lot of fact sheets. They happen to be in 7 Asian languages, so we're able to do more languages in the fact sheets than we are some of our major campaign materials. We're limited by resources to those 3 languages. Again, because of community requests, we have now a fact sheet African immigrants, both in English and in French. And so these are the types of requests and needs that we want to hear from you about. So this slide with community resources shows some of the things we've developed for use at the local level. One is a template where people can fill out themselves. It's designed so that you can advertise a health fair, a screening event, a clinic, where people are able to type in their own information either in English or other languages. We have a sort of infographic for use for educating people, and then a hepatitis wheel that our community members have used to sort of engage people at community health fairs and sort of test their knowledge. And so these are all examples of things that have come from community suggestions. So again, we're going to want to hear from you at the end about if there's something you would like us to consider developing. We want to hear from you. And then just a reminder that we also have some provider tools. One is a serologic test results interpretation sheet. It's one of our more popular ones. We also have developed one recently for testing pregnant women. This is for perinatal providers. And then there's sort of a info sheet just reminding providers that CDC recommends Asian Americans and people from other parts of the world get tested. And it's one our community members have used to sort of send out to providers to try to educate them about who should be screened for hepatitis B. So at this point, I want to shift to our Know Hepatitis C campaign, our Know More Hepatitis campaign. We launched this campaign in the fall of 2012. This has a very different target audience, given it's a different disease. It's to increase testing among those born from 1945 to 1965, or baby boomers. So our audience is both baby boomers as well as the primary care providers that care for them. Like the B campaign, we've had 2 more phases since the initial launch, in January of 2015 and then in April of 2016. And on this slide is the campaign website, where you're going to find all of the materials that I'm showing you today and that much more. So next slide, please. So communication objectives for this campaign, you'll see some parallels here in that both the campaigns are trying to increase testing for hepatitis C, this in people born from 1945 to 65. We also have some secondary communication objectives for this campaign. Similar to the B, we found some myths among baby boomers. Baby boomers are not aware that they're more effective, so we say that they're 5 times more likely to be infected. Around half are unaware of their infection. The same myth about, we heard over and over again, people saying, I would know if I were infected because I'd have symptoms. So we are educating them that there are often no symptoms with this disease. Many people don't know how they would be initially screened, so we say a blood test is needed to determine if you're infected. And then people were not aware that there are new treatments that can cure the disease, and that was motivating to people in terms of getting tested. Like hepatitis B, there was not really an understanding of the link to liver disease or that hepatitis C could be quite serious and even deadly. And unfortunately, also like hepatitis B, we did find that there was stigma associated with hepatitis C, and particularly with hepatitis C, some of the risk behaviors, namely injection drug use. So you'll see here a parallel slide with our campaign materials. You'll see many of the same strategies and tactics that we use, both in terms of broadcast using TV and radio. We have a digital and social media presence. This campaign, by the way, is entirely in English. We also use print and out of home. We have print ads, airport dioramas, billboards, transit ads. All of this, by the way, is relying on donated space. We do have a patient education component to this campaign, which is posters, fact sheets, an online risk assessment, and a little bit more in terms of provider clinical tools. We have some algorithms. We work with our CDC partners like Medscape and Quantia MD to provide routine or ongoing webinars on topics related to hepatitis C. We have clinical summaries, and we also have a grantee in University of Washington that has done a Hep C Online course that is a very comprehensive clinical training for hepatitis C. And that's a way to support the sort of test and treat objective that we have. So as I mentioned, we rely primarily on donated space and time. We work with our partners in the news media office here at CDC to do news media outreach. We distribute our TV and radio PSAs nationwide. Likewise, we do that with print ads in the form of print ads in newspapers, magazines, but most of our print comes out in film, as it's called, which is airport dioramas, billboard, mall, and transit ads. And then we also have an active social media presence and heavily on our website to also spread information. We do have a small budget for digital advertising. That digital advertising actually drives traffic to our website as well as to our broadcast PSAs. And like the B campaign, we want to work with you all in the community to extend the reach of this campaign. So this slide coming up shows some of our campaign materials. As you can see, we have quite a suite of them, from a variety of posters to choose from, infographics, fact sheets, a sample of our Twitter handle, which is CDC Hep. And the next slide shows our two new TV PSAs. If you haven't seen them, the first one is actually a collage of faces talking about who's affected, and it's really trying to get at the idea of anyone and everyone can get hepatitis C. It doesn't discriminate, and it does that by one person morphing into another person, all having a message about hepatitis C. And then the second PSA that you see down on the corner is people talking about different facts related to hepatitis C, and to make it visually interesting, they're actually drawing it on a chalkboard and sort of talking on camera. This one tested extremely well with our baby boomers. They really love seeing the visual with the facts on it and the sort of verbal reinforcement. So we've recently released these two new TV PSAs. We also have on the next slide a couple of print concepts that are both posters as well as digital. So you'll see we got tested for hepatitis C. Those are the multiple faces that came from that TV PSA. You can see the parallel with the chalk art in terms of the one in the middle on the top. We had a very clean, simple poster digital ad on the bottom, just saying that 75% of people with hepatitis C were born from 1945 to 65. And then the idea that hepatitis C is often hidden because people don't have symptoms is addressing that myth that we referred to earlier. So these are 4 of our new print digital materials. So I wanted to just show you some pictures from the field. These come from various parts around the country. Some of those are actually in airports, some are in bus shelters, some are in transit places for bus stops, and then obviously a highway billboard. So this is some of our work in the field that we've been able to capture. And the next slide here shows our TV PSA airplay through November of last year. We literally just got some new data that we're analyzing right now to look at the various markets that we've been able to get our TV PSAs played. As you can see, we've gotten in most major markets around the country. Our estimated value from the ads is almost $9 million, and that translates to 1.2 billion audience impressions. And an audience impression is a theoretical that someone was watching the TV when that was the PSA was played. So next slide, please. So just to summarize, what we have here is the campaign reach to baby boomers when you combine all of the different media strategies that we use. We have over 6.7 billion audience impressions. That translates to more than $23 million worth of donated media value. An underestimate of what we've been able to do, because some of our vendors that we work with will tell us that they've successfully placed like a billboard or an airport diorama, but they'll only track it for 3 or 4 months. So that's what we have actual dollar value on. But we know, and we've been able to see, and some of our partners have reported that we've had ads up for much longer than just a couple of months that we have the tracking for. So we know we have at least this much. So I wanted to just conclude this part of the talk about the hepatitis C provider tools. Similar to B, we have both an interpretation of serology, a algorithm for testing, something that is tied to the campaign but probably a little bit more focused on high-risk individuals is a comprehensive guide to Hep C counseling and testing. On the next slide, you're going to see some of our training resources. In particular, we're very pleased with our Hep C Online done by the University of Washington. As I mentioned, that's a very comprehensive online training, but it also allows people to go and just pick out particular modules. It also has different clinical tools and calculators and reference libraries on there, as well as slide sets. So if you want to take some slide sets, you can take slide sets from them and use them, incorporate them in your own presentations. And this is free, by the way. They do offer free CMEs and CNEs. So I wanted to end today by just talking about a few other updates and resources. You heard me mention the risk assessment. The risk assessment is an online tool, and it's actually designed to assess a person's risk for hepatitis A, B, and C. We certainly were keeping in mind our baby boomer audiences and Asian Americans, but it also has past risk behaviors. This tool can be used in the privacy of a person's home. It can be used on your phone or at a doctor's office. And what happens is, based on what you've answered with the questions, or about 20, it takes about 5 minutes, you get tailored recommendations based on CDC recommendations that you can either print out and bring to your provider or hear what CDC would recommend. And on this slide, you have the URL to the risk assessment. So on the next slide, I wanted to show you just the welcome screen. This sort of explains the risk assessment. And the next couple slides are just samples from the risk assessment. So here's a sample recommendation for a baby boomer. And the recommendation actually is 2 parts. There's a simple one that's just get a blood test. And if you want a little bit more detailed recommendation, you can ask for more details, and it will tell you why you got that particular recommendation. And you can either just print the recommendation, or you can print the recommendation and the explanation. This slide shows a recommendation for someone who has a parent who was born in a region where hepatitis B is common. So they answered the question that 1 or 2 of their parents were born in one of the areas that has high rates of hepatitis B. They determine that from a map that they show the user. And so this is the recommendation saying get a blood test for hepatitis B. One of the ways you can help spread the word about the risk assessment is we actually have on our website some buttons and badges that you can download and put on your own website, and it'll invite people to take the online risk assessment to see if they're at risk. So if that's something that you think is useful to your work, we would encourage you to go and take our buttons and put them on your website. Because it's May, I also wanted to mention the different things that we're doing for Hepatitis Awareness Month. We have a variety of digital tools, radio scripts promoting the risk assessment. We also have a Thunderclap on May 19th. We hope you will sign up for that. There's some details on here, and Amanda's here with me, who's leading the Hepatitis Awareness Month efforts as well as the Thunderclap. You can always follow us on Twitter if you're not already. We have ABCs of hepatitis and sample proclamations. These are all just tools that's available to you all to use to help with Hepatitis Awareness Month activities. We also have some features on our DVH website. One that's just because it's Hepatitis Awareness Month, we cover the ABCs. And so there's a feature on the ABCs of hepatitis and a call to take the risk assessment. And as I mentioned, we have a Thunderclap coming up, so we hope you'll consider signing up for that. There are details on this page. And then I wanted to end today by just opening it up, which I guess we want you to type your questions in the box or email them to Tina. But we want to hear from you about what are some of your needs, or if you have suggestions for CDC based on what you're seeing. This only represents two aspects of the work that we do here in the division, focusing on broad-based education campaigns. We do have other people that are working on different efforts, including with people who inject drugs and incarceration and other aspects. So if you are wondering why you didn't hear about that, we were talking today about our two educational campaigns.
Great. Thank you so much, Dr. Jorgensen. This is Tina Broder from NVHR, and I'll be moderating the Q&A. So a reminder to please, since we have everyone muted, the easiest thing is to submit your question through the webinar online question function, or you can send a chat message, or alternately, you can send me an email at tbroder@nvhr.org. So the first question I'll start with is, are there American Indian, Alaskan Native hepatitis C resources available or in development?
That is something that we have heard the need for, and I'm hearing it again, so we will put that on our list as something that is needed so that it's culturally specific to Native Americans.
Thank you. And is there also a hepatitis C wheel for health fairs, and if not, can we have one?
We hadn't considered that, but that's certainly something if you want to take a look at what's on the B. And if you think that would be useful to us, that would be helpful for you to email Tina, or on the very last slide, you'll see the contacts for the B campaign and the C campaign. I'm here with Sherry Chen, who works with me on the B campaign, and Amanda, who works on the C campaign, as well as leads our social media effort. So contact one of us with your request and sort of what you, that's what we want to hear, what you would want, how you would use it, and the value you believe it brings to your efforts.
And what else can be done besides the fact sheet that exists to help reach African immigrants?
That's something that we're hearing. I think we are challenged by our limited resources. I'm hopeful next year we actually have a little bit more money to focus part of the B campaign on some of the African immigrants. It would be important for us to hear what languages and what populations you serve, and a little bit about some of their literacy skills in terms of what would be helpful for educating African immigrants.
And there's a question from David Barton from the American Liver Foundation. He said, many of our divisions have events for National Hepatitis Testing Day. Where can they upload and share information about their events? The old link on the npncdc.gov census.gov website is no longer working. So can you tell us now how you would like groups to share information about their events?
Yes, what we are doing is trying to move towards ongoing testing and linkage to care. So what we hope people are doing is not just single testing events, although we recognize their value, but to making sure that all of you who have clinics or services that you provide, that you register those with the INPEN.org database, and that way you can put down whether you have testing, vaccination, treatment. You can answer different questions. I think that's a movement with CDC hearing concerns about people just doing testing and not doing any follow-up, and also not doing testing follow-up to confirm that people who are infected with C are still chronically infected, and then probably most important, getting those individuals. So there was a decision with limited resources here at CDC to focus on the larger ongoing database. And what we also heard from people is that they felt the best value for those of you who are doing testing events was to have you guys publicize those in your local area. I think we were concerned with the limited number of events that we had listed on the INPEN testing event page, that it said put in your zip code, and we were concerned about the user experience if they were sent 200 miles for a testing event. So it was great to sort of capture what you guys were doing. We were concerned that it might not be the best in terms of a user who was looking for a testing event. Hope that helps explain our decision here.
Great, thank you. We have a question. How can we assist the CDC in getting PSA TV coverage in our state?
Great question, and we'd love to work with you. There are a couple ways we can do that. If you want to contact us, we can either work with you to contact the various stations. We can also put the DVDs in your hands and have you physically deliver them to the station with a plea for people to air them. Sometimes station managers are much more receptive when it's a local person making that ask, and particularly if there's a service connected to it. That really helps get that airplay done. So we'd love to work with you on that.
And are there materials and PSAs created in Spanish, and what specific efforts to do outreach to the Latino community do you have?
That's another area where, unfortunately, right now we have not had resources to do much in the way of materials in Spanish. We do have a couple of our fact sheets translated into Spanish. What we try to do when we develop materials in another language is try to work with experts from that particular culture who have cultural competence and expertise both linguistically and culturally. So we do not believe in taking materials and just translating them. What we want to do is develop them in language of the recommended approach. And without more resources at the moment, we've not been able to do much for Spanish speakers, unfortunately.
And I have a question about using the materials locally. It says the literature states that we aren't to alter or add to it, but have you considered leaving a space open on your printed or digital marketing campaigns for us to list and share local resources?
We have tried to do that where we've given you a little bit of space to do that. We do have permission for government agencies to put their logos on if they don't alter anything. On the B side, we do have templates that are not CDC branded in which you can do whatever you want with them. If you have a specific request, we can try to put that request into our sort of co-branding process. I will tell you that co-branding is not easy to do, and it takes time, and there's a lot of criteria about who can do it and not do it. But there is a general belief in supporting nonprofits and local organizations at the local level. So if that describes you, we might have some luck in getting a co-branding or working with you to accomplish what you asked.
Someone said, I noticed you had a guidelines flyer that can be sent to physicians for hepatitis B. Is there one for hepatitis C?
that's something that you would like, we can work on it. We do have some physician ads that sort of talk about the testing, and I believe we do have a sort of one-page description of the rationale for testing. It's primarily focused on baby boomers, so what we would want to hear from you is what you would like to see, if it's baby boomer focused or you want it broader for all populations for hepatitis C. But if that's something that you feel would be useful and would be helpful to you, please send us that request.
I have another that says, thank you for the awesome presentation. Are there resources out there that look at dissimilarities, similarities between, and/or best practices for different Asian groups or multi-ethnic, quote, Asians?
We are fortunate enough to work with an Asian contractor who actually has that expertise. Familiar with a little bit of differences that we've encountered with our own work. I would say that unfortunately Vietnamese tends to probably know the least about hepatitis B. Might be a little bit more isolated. There's probably more resources in Chinese, particularly written. So if you have a specific question, Sherry and I can try to see if we can answer it, or more importantly, our contractor who specializes in Asian communication could answer for you.
I have another question, which is that we've seen a lot of information recently about the cancer report, and we were wondering whether that would be used in the development of new hepatitis B and C materials to highlight the impact of hepatitis B and C on liver cancer.
It's a great question. We are trying to emphasize the link to liver cancer. We will be beginning our new phase of campaign development. Let me explain what we do. We work with our contractor to come up with sort of concepts or rough drafts of ideas to convey various messages, and that certainly can be one of them, both the impact of liver cancer and the link with hepatitis to liver cancer. What we do is we test that message as it's embodied in the creative concept, and we probably throw away more than half of the concepts. So what you saw in terms of our final materials are ones that really tested well. So we certainly can bring that to the development process over the next year and emphasize the cancer rates, the link to liver cancer, and see how that resonates with our target population.
And another question is there a possibility that higher language staff could help prioritize outreach to these communities?
Could you please?
Is there a possibility that hiring African or Spanish language staff could prioritize outreach to those communities?
Are you talking about staff here at CDC or staff at the local level? I guess I'm not quite sure I'm understanding the question, because certainly we support having people that are from the culture working with that culture. We believe that brings the cultural competence and understanding of some of the subtleties within what different cultures face and experience. Here at CDC, I think we do that by hiring contractors with that expertise.
And I'll let the person who asked that, if they had any clarification or follow-up, but I'll go ahead and move to the next line. Do you have any ideas about approaching medical doctors in our community to share information with them about the important recommendations to get all baby boomers tested? How can we get doctors to start testing every baby boomer routinely?
That's a great question. If I knew the answer, we would have them all tested. I sometimes joke that physicians can be the hardest to reach. We have done focus groups with physicians, and I think what we're hearing is that there is a lot on their plate. I think they too need to be educated about the benefits of testing. I think some of the barriers we were hearing from them is that there's a lot for them to cover. Some similar consumers, that their patient population is not that kind of people, so they don't need to test them. Some are concerned about the reimbursement and believe that it's not reimbursed, and so don't want to deal with the charges and angry patients. So I think I would actually turn that back to you all and see if you could get more information about what are some of the barriers in your community with physicians when you ask them, are they testing, and if not, why not? I think understanding those barriers will help us all collectively figure out how to solve this problem.
And can you tell us, you know, there have been these different phases of the campaign's launch, so can you tell us what you've learned from the earlier phases and how that was integrated into the later phases of the campaign?
That's another great question. I think we were learning that the link to liver cancer was probably something that was more motivating than we originally thought. I think when we started the campaign, people did not know anything about hepatitis, either B or C. I think a lot of the private sector ads promoting the treatments for hepatitis C have made the disease, at least hepatitis C, more visible than when we started the campaign, which was prior to the current treatments that offer a cure. I think we still have our work cut out in terms of some of the barriers around stigma. It's not me. I would know I was infected. I would have symptoms. Some people also believe that they have been tested because if it's a blood test, after all, those of us who are baby boomers get lots of blood tests every year at our annual exams. And so there's a belief that they've already been tested. So there are a lot of different contributing factors. And some of those have changed over time, and some of them, unfortunately, if they've changed, they haven't changed much.
In the future, what other campaigns or materials would you like to create for Hepatitis Awareness Month?
I think we would turn it back to you. What would you like us to see us do? What are some of the things that would be helpful to your work?
And can you share some more examples of how these materials have been used for community testing events?
Yeah, on the B side, I think people have used the posters as a way to draw people in. They've used the fact sheets as handouts to explain what's going on. They've used the wheel to sort of engage people in a sort of game where they can spin and learn about it. We've had people mail out the physician materials, email it out to physicians. We've had some people use the poster in the form of a print ad where they've put it in their local paper. They've been able to negotiate that. People have used the templates to publicize their services, so they'll post them in the local community, whether it's a Chinese bakery or whatever. I think on the C side, we don't have quite as much a need or active community component in terms of reaching baby boomers. What we know, at least from some data, that many baby boomers are in fact covered by health insurance, so that's where we're focusing a little bit more on the primary care to have the docs test baby boomers, but also have baby boomers aware that if their doc brings it up, it's something that they've heard about and it's like, oh yeah, I want it. You know, if it's helpful, you can play the PSAs. We are aware that many of you are working with higher risk groups or people who are either uninsured or underinsured, some of which obviously are baby boomers. I think the access to care issue is a challenge when someone is not insured, so this campaign was really more designed for people that were insured, because some of the challenges I think you face with uninsured or high-risk populations are a little bit different and require different strategies.
Another question which actually ties into that a bit is, in terms of injection drug users, are there handouts, brochures that can be used at treatment centers to encourage participants to be tested?
We do have a fact sheet that is specifically designed for people who inject drugs, which encourages them to get tested for hepatitis as well as vaccinated against hepatitis A and B. We did just hire here at CDC a new subject matter expert in injection drug use, Alice Asher, for those of you who may know her from UCSF, and we plan on working with her on hearing about some of the recommendations that she has in terms of educational and other needs for people who inject drugs. So look for that in the future.
And so that's the last of the questions I had submitted. I'll give folks a minute if you want to submit any final questions through the question or chat function, or email me. And if I get any follow-up questions, I can go ahead and send them to the CDC team. Again, everyone will receive a copy of the slides and a link to the recording, and both of those will also be posted on our website later this week. So not seeing any additional questions, I'll turn it back to Ryan for some closing comments.
Great, thank you. So I really want to thank Dr. Jorgensen and Sherry and Amanda, not only for being on the webinar today and sharing great information and engaging with community advocates and educators about needs, but also for all of your work. I think everybody knows there's a lot of great information coming out from CDC this month for Hepatitis Awareness Month and Hepatitis Testing Day, and lots of resources for the community. So I just want to thank you on behalf of NVHR for all of your leadership and all of your hard work working to fight and end the Hepatitis B and C epidemics. So we will definitely continue to collect questions and input from folks. People might have come up with some questions or some thoughts after thinking for some time, and we'll encourage people to continue to submit those to us, and we'll get them to you, Dr. Jorgensen. So again, I really want to thank you.
No, I was going to say thank you, Ryan. And again, if I can just put in a plea to those of you who are out there listening, we want to hear from you. We want to hear what your needs are. That helps us in terms of on your behalf of this is what we're hearing from community members that we need to help serve them and help them do their job.
Thank you very much, and thank you everyone for participating on today's webinar. I know it's a very busy month, and appreciate your participation today. So have a great rest of the day.